Good morning, and thank you for being here today. Let me start with a simple but unsettling question. What if something you take every single day, something you believe is protecting your health, is quietly harming your heart? For years, vitamins have been marketed as safe, natural, and essential, especially for older adults. Many seniors are encouraged to take supplements to stay strong, prevent illness, and live longer. But what if one widely used vitamin is doing the exact opposite, putting dangerous strain on the aging heart? As a health professional who has spent years studying cardiovascular health in older adults, I was shocked by what recent research and clinical evidence are revealing. This isn't about scare tactics, and it's not about rejecting all vitamins, it's about awareness. Because in people over 50, the body changes, and what once helped you may now be working against you. Today, we're going to talk about one specific vitamin that millions of older adults take without a second thought. A vitamin that, when taken incorrectly or in excess, has been linked to heart rhythm problems, artery calcification, increased blood pressure, and even higher risk of heart attacks in seniors. Most importantly, I'll explain why this happens as we age, who is most at risk, and what you should do before continuing or stopping any supplement. This information could protect not just your heart, but your life. To understand why this vitamin can damage the hearts of older adults, we first need to understand a simple but often overlooked truth. The body you have at 60 or 70 is not the same body you had at 30. Aging changes how your heart, blood vessels, kidneys, and metabolism respond to nutrients, even ones that were once harmless or helpful. This vitamin is commonly taken because it's believed to strengthen bones, boost immunity, or improve overall vitality. Doctors prescribed it for decades, advertisements praised it, families encouraged their parents to take it daily. But modern research shows that in older adults, excess or improper use of this vitamin can disrupt the delicate balance that keeps the heart healthy. As we age, the heart muscle naturally becomes stiffer. Blood vessels lose elasticity, calcium regulation, mineral absorption, and electrical signaling inside the heart all become more fragile. When this vitamin is taken in high doses or without proper monitoring, it can push these systems into dangerous territory. One of the biggest concerns is abnormal calcium buildup in the arteries. In younger people, the body efficiently directs calcium where it belongs, mostly into bones and teeth. But in older adults, excess levels can end up in the wrong places, especially the coronary arteries. This process, known as vascular calcification, hardens the arteries, reduces blood flow to the heart, and significantly increases the risk of heart attacks. But that's not all. This vitamin can also interfere with the heart's electrical system. The heartbeat depends on a precise balance of minerals to maintain a steady rhythm. When that balance is disturbed, older adults may develop irregular heartbeats, also known as arrhythmias. These can cause palpitations, dizziness, shortness of breath, fatigue, or sudden fainting. In severe cases, arrhythmias can be life-threatening. Another critical factor is the decline in kidney function with age. The kidneys play a key role in regulating excess vitamins and minerals in the blood. As kidney efficiency decreases, which happens naturally as we grow older, this vitamin can accumulate to toxic levels, even when taken at doses that seem normal or recommended on the label. This buildup increases strain on the heart by raising blood pressure and altering fluid balance. Many older adults taking this vitamin experience unexplained hypertension, swelling in the legs, or chest discomfort, without realizing their supplement may be contributing to the problem. What makes this situation especially dangerous is that the symptoms are often silent or gradual. Unlike a sudden illness, supplement-related heart damage develops slowly. A person may feel a little more tired, a bit short of breath, or notice mild chest tightness, but dismiss it as aging or stress. Meanwhile, the heart is under constant strain. Even more concerning is the fact that many seniors take this vitamin alongside heart medications, such as blood pressure drugs, diuretics, or cholesterol-lowering medications. These combinations can intensify side effects and reduce the effectiveness of life-saving treatments. Yet very few people are warned about these interactions. Perhaps the most troubling part is that more is not better. Older adults often believe that taking extra vitamins will protect them from disease. In reality, excessive intake of this particular vitamin may accelerate heart disease instead of preventing it. This does not mean all vitamins are bad, and it does not mean this vitamin is harmful to everyone. The danger lies in unmonitored, high-dose, long-term use, especially in adults over 50. The aging heart requires precision, not excess. What once supported health can quietly become a burden when the body's ability to regulate it declines. And that brings us to the next critical question. Who is most at risk, and why do so many older adults never realize this vitamin is affecting their heart until serious damage has already occurred? One of the most alarming aspects of this issue is not just that this vitamin can harm the heart, but who it harms the most. The damage does not happen randomly. Certain older adults are far more vulnerable, and many of them fit a profile so common that millions are at risk without realizing it. First and foremost, age itself is a major risk factor. Adults over 50 experience gradual changes in metabolism, circulation, kidney function, and hormone regulation. These changes affect how vitamins are absorbed, stored, and eliminated from the body. What once passed safely through the system can begin to accumulate, quietly stressing the heart over time. But age is only the beginning. People with existing heart conditions are especially vulnerable. If you have high blood pressure, coronary artery disease, a history of heart attacks, irregular heartbeat, or heart failure, this vitamin can worsen your condition. It may increase arterial stiffness, elevate blood pressure, or disrupt the heart's electrical signals, placing additional strain on an already compromised cardiovascular system. Next are older adults with reduced kidney function, a group far larger than most people realize. Many seniors have mild to moderate kidney decline without any obvious symptoms. Blood tests may show only small changes or none at all. Yet even subtle kidney impairment can dramatically reduce the body's ability to clear excess vitamins and minerals from the bloodstream. As levels build up, the heart pays the price. Another high-risk group includes older adults taking multiple medications. This is known as polypharmacy, and it affects a majority of people over 60. Blood pressure medications, diuretics, calcium channel blockers, cholesterol drugs, and heart rhythm medications can all interact with this vitamin in harmful ways. These interactions may amplify side effects, reduce medication effectiveness, or trigger dangerous heart events, yet they are rarely discussed during routine checkups. Postmenopausal women also face elevated risk. After menopause, hormonal changes alter calcium handling, bone metabolism, and cardiovascular function. Many women are encouraged to take vitamins for bone health without being properly evaluated for heart risk. Over time, this imbalance can shift calcium away from bones and into arteries, increasing the risk of heart disease. Equally concerning are older adults with diabetes or metabolic syndrome. These conditions already damage blood vessels and increase inflammation. When combined with excess levels of this vitamin, arterial damage can accelerate, making heart attacks and strokes more likely. But perhaps the most dangerous group of all is older adults who believe supplements are always safe. Many seniors take this vitamin because a doctor once recommended it years ago. A friend or family member suggested it. A television advertisement promised protection. The label said natural or essential. Over time, the original reason for taking the vitamin may be forgotten, but the habit continues, sometimes for decades. Dosages may increase, new supplements may be added, yet very few people ever reassess whether their body still needs it. This leads to one of the most serious problems: lack of warning signs. Unlike sudden illnesses, vitamin-related heart damage develops slowly. Symptoms are subtle and easily mistaken for normal aging: fatigue, shortness of breath, mild chest pressure, occasional dizziness, heart palpitations that come and go. These signals are often ignored, dismissed, or blamed on stress or poor sleep. Even routine medical visits may not catch the problem. Many doctors do not routinely ask about supplements. Blood tests may not always reveal early toxicity. As a result, the vitamin continues to do damage while the heart struggles silently. Another reason this issue goes unnoticed is overlapping symptoms. If someone already has high blood pressure, joint pain, or reduced stamina, it becomes difficult to recognize when a supplement is making things worse. The vitamin hides behind existing conditions. What makes this especially tragic is that most of these cases are preventable. With proper screening, dose adjustment, and individualized guidance, the risk can be dramatically reduced. Yet many older adults never receive that guidance. In short, the people most at risk are not extreme cases. They are everyday seniors, retirees, grandparents, caregive, doing what they believe is right for their health. And that leads us to the most important question of all. How can older adults protect themselves, recognize warning signs early, and make safe, informed decisions before serious heart damage occurs? Of the most dangerous aspects of vitamin-related heart damage in older adults is not the damage itself. It's the delay in recognizing it. By the time many seniors realize something is wrong, their heart has already been under strain for months or even years. That's why understanding the warning signs is not optional. It's essential. The problem is that the early symptoms are subtle. They don't announce themselves loudly. They creep in slowly, blending into everyday life and disguising themselves as normal aging.
This is why so many older adults miss the signals their heart is sending.
One of the earliest and most common warning signs is persistent fatigue. This isn't the usual tiredness after a long day. It's a deep, lingering exhaustion that doesn't improve with rest. Many seniors assume it's just part of getting older, but in reality, the heart may be working harder than it should to pump blood through stiffened or narrowed arteries. Another red flag is shortness of breath, especially during activities that were once easy, walking, climbing stairs, or doing light household tasks. When arteries become hardened or blood flow is restricted, the heart struggles to deliver oxygen efficiently. The lungs feel the strain and breathing becomes labored. Heart palpitations are another critical warning sign. These may feel like fluttering, pounding, skipping, or racing in the chest. Some people experience them only occasionally, while others feel them daily. Because they often come and go, they're easy to dismiss. But palpitations can indicate disturbances in the heart's electrical system, something that certain vitamins C8 worsen in older adults. Many seniors also experience chest discomfort, not always sharp pain. It may feel like pressure, tightness, fullness, or mild burning. Because it doesn't always resemble the dramatic chest pain shown in movies, it is often ignored. Any unexplained chest sensation should be taken seriously, especially if it appears during physical activity or emotional stress. Dizziness and lightheadedness are additional warning signs. These symptoms can occur when the heart is unable to maintain steady blood flow to the brain. Some people experience brief episodes when standing up, while others feel unsteady throughout the day. Fainting or near-fainting episodes are especially concerning and require immediate medical attention. Another overlooked symptom is swelling in the legs, ankles, or feet. This may indicate fluid retention caused by increased strain on the heart. While swelling is often blamed on poor circulation or long periods of sitting, it can also signal that the heart is struggling to manage fluid balance, an issue that certain vitamins can exacerbate. High blood pressure that becomes difficult to control is another important warning sign. Many older adults take medications for hypertension and assume that rising numbers are simply part of aging. In reality, excess vitamin levels can interfere with blood vessel function and make blood pressure harder to manage. What makes these warning signs especially dangerous is that they often appear gradually and simultaneously. A little fatigue here, slight breathlessness there, occasional dizziness. None seem serious on their own, but together they form a clear pattern of cardiovascular stress. Another reason these signs are ignored is overlapping conditions. Arthritis, diabetes, lung disease, and general deconditioning can mask heart-related symptoms. Older adults may attribute every new discomfort to an existing diagnosis, never considering that a supplement could be contributing to the problem. Even more concerning is that many seniors do not associate supplements with risk. Because vitamins are sold over the counter and labeled as natural, people assume they are harmless. As a result, they may never mention them to their doctor, even when symptoms appear. This silence can be costly. Doctors rely on accurate information to make diagnoses. If supplement use isn't discussed, the true cause of symptoms may be missed. The heart continues to suffer, while treatment focuses on managing symptoms instead of addressing the underlying issue. The most important message here is simple but powerful. Do not ignore changes in how your body feels. Aging does not mean accepting constant fatigue, breathlessness, or heart discomfort. These are signals, not inconveniences. Early recognition can prevent serious complications such as heart attacks, arrhythmias, heart failure, and strokes. In many cases, adjusting or discontinuing a vitamin under medical guidance can significantly reduce risk and improve quality of life. So the question now becomes, what should older adults do next? How can they protect their hearts while still supporting their overall health safely and effectively? After understanding the risks, identifying who is vulnerable, and recognizing the warning signs, the most important question remains, what can older adults do to protect their hearts, starting now? The answer is not fear, and it is not abandoning all supplements. The answer is informed, intentional, and supervised use. When it comes to heart health in later life, precision matters far more than quantity. The first and most critical step is reassessment. Many older adults take vitamins out of habit rather than necessity. A supplement that was recommended 10 or 20 years ago may no longer be appropriate. Eat today. Aging changes nutritional needs, absorption rates, and tolerance levels. What once supported health may now create imbalance. Older adults should regularly review every vitamin and supplement they take, not just prescription medications. This includes multivitamins, bone health supplements, immunity boosters, and fortified products. Nothing should be assumed harmless simply because it is sold over the counter.
The second step is medical transparency. One of the most common and dangerous mistakes seniors make is not telling their doctor about supplements.
Physicians cannot fully assess heart risk without knowing everything that enters the body. Supplements can interact with medications, alter lab results, and contribute to symptoms that appear unrelated at first glance. Bringing a complete list of vitamins and dosages to medical appointments can be life-saving. This simple act allows healthcare providers to identify potential interactions, excessive intake, or unnecessary supplementation before damage occurs. The third step is individualized dosing, not generic recommendations. Many vitamin labels are designed for the general population, not for aging bodies with specific health conditions. Older adults often require lower doses, not higher ones. More is not safer. More is often riskier. This is especially true for vitamins that influence mineral balance, blood pressure, kidney function, or heart rhythm. The goal is adequacy, not excess. A well-nourished body functions best within narrow ranges. Another essential strategy is prioritizing food over supplements whenever possible. Nutrients obtained from whole foods are absorbed more gradually and regulated more naturally by the body. Fruits, vegetables, lean proteins, whole grains, and healthy fats provide complex nutrient combinations that supplements cannot replicate. Food-based nutrition reduces the risk of overload and supports overall cardiovascular health through fiber, antioxidants, and anti-inflammatory compounds. Supplements should support the diet, not replace it. Monitoring is equally important. Older adults who use vitamins long-term should undergo periodic evaluations, including blood tests when appropriate. These assessments help ensure nutrient levels remain within safe ranges and allow early detection of imbalances before symptoms appear. Equally vital is listening to the body. Any new or worsening symptom, fatigue, breathlessness, palpitations, dizziness, swelling, or changes in blood pressure, should prompt immediate attention. These are not inconveniences to tolerate. They are messages the heart may be under stress. One of the most empowering actions seniors can take is questioning assumptions. Just because a vitamin is popular does not mean it is safe for everyone. Just because it helps someone else does not mean it is right for you. Health decisions should never be based solely on marketing, trends, or anecdotal advice. Education plays a crucial role here. Older adults who understand how aging affects the heart are better equipped to make informed choices. Knowledge replaces fear and prevents complacency. It is also important to avoid self-adjusting doses. Increasing intake during illness, stress, or fatigue without professional guidance can be dangerous. Supplements are not emergency solutions. Sudden changes can overwhelm the heart and kidneys. Finally, the most powerful protection is collaboration with healthcare professionals. Doctors, pharmacists, and dietitians are allies, not obstacles. When supplements are used thoughtfully, monitored appropriately, and tailored to individual needs, they can still play a supportive role in healthy aging. The key message of this entire discussion is not that vitamins are inherently harmful, it is that again, hearts require careful balance. What protects one system can strain another if used incorrectly. Heart health in later life is not about taking more pills. It is about making smarter, safer choices by reassessing habits, communicating openly, prioritizing food, monitoring symptoms, and seeking guidance. Older adults can reduce unnecessary risks and protect the most vital organ they have, because the goal is not just to live longer, but to live stronger, safer, and with a heart that truly supports quality of life. At this stage, one truth should be clear. Heart health in older adulthood is not about doing more. It's about doing what's right. The real danger is not a single vitamin on its own, but the assumption that anything labeled natural is automatically safe, regardless of age, health status, or dosage. This final key point is about empowerment. It's about giving older adults the confidence to make informed decisions, ask the right questions, and take ownership of their health without fear or confusion. The first step toward long-term protection is changing the mindset around supplements. Vitamins are not insurance policies. They do not cancel out poor nutrition, inactivity, stress, or underlying disease. They are tools, and like any tool, they must be used correctly. When taken blindly or excessively, they can create new risks instead of reducing existing ones. Older adults should understand that the goal is balance, not perfection. The heart thrives when the body is supported consistently and moderately. Extreme approaches, high doses, stacking multiple supplements, or chasing the latest health trend often do more harm than good, especially in aging systems. Another critical aspect of long-term heart protection is continuity of care. Health decisions should not be isolated events. A vitamin choice made today should be revisited regularly as health condition, medications, and lifestyle factors evolve. What is safe this year may not be safe 5 years from now.
This is why routine checkups are so important, not just to detect disease, but to reassess prevention strategies.
Supplements should be part of that conversation, not an afterthought. Equally important is clear communication across generations. Many older adults take supplements because adult children, friends, or caregivers encourage them to. While well-intentioned, this advice can sometimes be misguided. Families should support seniors by encouraging informed discussions with healthcare professionals, not by promoting one-size-fits-all solutions. Education must replace assumption. Another powerful protective factor is lifestyle alignment. No vitamin can compensate for the absence of physical activity, sleep, stress management, and heart-healthy eating. These fundamentals regulate blood pressure, improve circulation, reduce inflammation, and strengthen the heart far more reliably than supplements alone. When lifestyle foundations are strong, the need for high-dose supplementation often decreases naturally. It's also essential to recognize that the heart does not fail overnight. Cardiovascular decline is usually the result of years of small, cumulative stressors. Supplements that subtly increase strain day after day can become part of that accumulation if not managed carefully. That's why prevention is so powerful. Small adjustments made early, lowering a dose, discontinuing an unnecessary supplement, improving diet, or addressing symptoms promptly can prevent major events later. Another key element of long-term safety is respecting warning signals. Older adults are often taught to push through discomfort, but the heart requires attention, not endurance. Ignoring fatigue, breathlessness, chest pressure, or palpitations does not make them go away. It allows damage to progress. Listening to the body is not weakness, it is wisdom. Perhaps the most important message of all is this: you are not failing your health by questioning a vitamin. You are protecting it. Asking whether something is still necessary, still safe, or still beneficial is a sign of responsibility, not doubt. Healthcare evolves, research evolves, and the aging body evolves. Health decisions must evolve too. The purpose of this discussion has never been to create fear. It has been to replace blind trust with informed awareness. When older adults understand how their bodies change, how supplements interact with those changes, and how to respond wisely, they gain control, not anxiety. In the end, protecting the heart is about partnership between knowledge and action, between patient and provider, and between prevention and care. A strong heart in later life is not built on assumptions. It is built on balance, it is built on awareness, and it is built on choices made with clarity and care. Because the most powerful medicine an older adult can have is not found in a bottle. It's the ability to make informed decisions that truly serve their heart and their future.